A lot of patients come to me because they want to know if they can get off of their medications or if there are alternatives in the holistic realm. And the answer is really individualized. It's not unusual for patients to come to me on 3 or even 4 or 5 or 6 medications, yet they're still really having a hard time. Maybe their depression or their OCD symptoms or their anxiety symptoms are still really severe. So when I see that patient and I see, 6 medications and they still don't feel well, that tells me that the medications are not doing what they're intended to do. Oftentimes the brain scans are really helpful in these cases because we can look at the brain and see which parts of the brain are working too hard or are not working hard enough. And based on that information, we can make medication changes. Sometimes we might swap out a medication. Just recently, I reduced medications for a patient and they felt better when we did so because I could see on the brain scan that they actually had some doses that were too high and they were not serving them. So from a perspective of some people, do they need to be on medications long-term? Sometimes. And sometimes I'm also able to swap people out for supplements instead of medications. Now, sometimes there are underlying causes that need to be addressed.